Welcome to the press conference 食物及衞生局局長陳肇始教授、衛生署署長陳漢賢醫生、醫院管理局行政總裁高拔陞醫生、政府資訊科技總監林偉喬先生、一般職系處處長陳順希先生。我哋稍後會先請陳局長先發言，咁然後就到發言局長，跟住又再會有一個提問時間嘅。咁而家先請陳局長。
各位市民、各位傳媒朋友。經過1年多嘅疫情呢，我哋嘅抗疫工作呢，而家呢係嚟到一個好關鍵嘅時刻。咁呢個呢，就係呢，我哋會好快會有新冠疫苗呢係到港，亦都可以呢係盡快展開全民嘅接種計劃。喺
We can start the vaccination program. COVID-19 pandemic has brought unprecedented challenges to the entire world. According to the World Health Organization, WHO, as well as health experts, that COVID-19 will not disappear before there is effective treatment as well as vaccines available. Safe and effective COVID-19 vaccination will provide protection from transmission to a certain extent. It will also minimize the damage to the health of infected persons. It is one of the most important measures to protect public health and our healthcare system, which is on the verge of reaching full capacity. The vaccines will also give us hope to return to normal lives. For quite some time, people have been awaiting eagerly for the vaccines. At the same time, there are doubts. I am the Secretary for Food and Health. I would like to send a clear message to everyone. All COVID-19 vaccines authorized by the government for emergency use have been assessed by experts to be safe, effective, with quality assurance, as well as showing that the benefit of vaccination outweighs risks. Although vaccines is something new, we still need further studies and observations on the effectiveness of the vaccine to stop transmission. But what we can be sure is that for individuals, especially those in priority groups, vaccination is better than no vaccination. And for the society as a whole, the more people that are vaccinated, the better, because the healthcare system will keep its integrity and society can resume normal. And it will also give us a better foundation to negotiate opening borders with other places. Thank you. We will now hear from the Secretary for Civil Service. I will now give you information about the details of COVID-19 vaccination program. As Professor Chen said, that we have been fighting the epidemic for 1 year. We have adopted a strategy to prevent imported cases and to stop a transmission inside Hong Kong, aiming to achieve zero infection. We have been enhancing and expediting various anti-epidemic measures. Although there are signs that the epidemic is subsiding, however, we should not let our guard down. We need to get vaccinated. All of us should get vaccinated to protect ourselves and to protect others in order to ride out this storm. Why is this so important? There are 4 points. First, to protect yourself. The vaccination will stimulate immunocytes to produce antibodies to fight the virus. It will also minimize the chance of serious infection. We need to protect our families and friends. Vaccination can slow down the transmission rate. Thirdly, to reduce the chance of an outbreak in the community. If there is a sufficient number of people getting vaccinated, there will be herd immunity, which in turn will drive down the chance of community outbreaks. This will protect our healthcare system. If the entire family is vaccinated, then the whole family is protected. The fourth reason is that it will help Hong Kong get out of the epidemic as soon as possible. People don't have to be restricted by various prevention and social distancing measures. Economic activities can resume normal. Our economy can start to recover again. People can also start their normal lives. So getting vaccinated is the most important of all measures. As soon as vaccines arrive in Hong Kong, we can start the vaccination program. According to prior agreements of procurement, there will be two types of vaccines arriving in Hong Kong. The first one is Sinovac vaccines from our country. The first batch, 1 million doses, will arrive in Hong Kong tomorrow afternoon. And Comirnaty from BioNTech, manufactured in Germany, will arrive before the end of this year. The first batch is about 1 million doses. Although we have procured 3 types of vaccines totaling 22.5 million doses, the amount itself is sufficient for vaccination for the entire population. However, since the vaccines will arrive in batches, just like what is happening now, so we have to set up priority groups to enable an orderly vaccination program in phases. Well, there are 2 scientific committees working on categorizing the various priority groups, and they have given their recommendations. Say, for example, priority groups are those who may end in fatality after an infection. The second group are those that who stand a higher risk of an infection, and afterwards they will easily transmit to fragile or weak people. The third group is that they are key workers. Based on the recommendations, we have made arrangements for the following 5 groups to receive vaccinations. First, healthcare staff in the healthcare system, as well as people who are working to fight the epidemic. 2, people who are over the age of 60, or those who accompany people who are over the age of 60, for a maximum of 2 people. The third group are workers in residential care homes for the elderly, as well as those for the disabled. 4, key workers, say, for example, people who are responsible for environmental hygiene, those who are responsible for dealing with sewage, wastes, etc. Or frontline workers who are in contact with the public a lot, say, for example, those from the discipline services, as well as postmen. And the other group is people who work in cross-boundary transportation, ports, as well as boundary points. There are 4 ways to get vaccinated. First, the 29 community vaccination center. 2, private doctors participating in the program. There are over 1,200 of them, operating at over 1,500 clinics. The third type are all 18 general outpatient clinics in the hospital authority, 4 residential care homes for the elderly and for the disabled.
We will set up community vaccination centers in all 18 districts. Most of them are located in sports centers. The exact locations will be uploaded later to our immunization program thematic website, www.covidvaccine.gov.hk. The vaccination centers will have a healthcare staff administering the vaccines for the public. The operators will include Hospital Authority, Department of Health, medical institutions and organizations, for example, private hospitals, private medical institutions, or medical professions associations, requiring over 1,000 healthcare staff. Over 1,000 civil servants will provide administrative support and management at the vaccination centers. These vaccination centers will be operated for at least 6 months. We will set up a total of 29 vaccination centers, of which 15 of those will be operated by medical facilities, medical associations, and private hospitals. The Hong Kong U Medical School will operate 1 vaccination center. 4 private hospitals will operate vaccination centers in 5 venues within the hospitals. And there will be 7 centers run by the Hospital Authority and 1 run by the Department of Health. Depends on the different arrival time of the vaccines, the quantity, and the immunization progress. We will open these centers in stages. The 29 community vaccination centers, 24 of which will be dedicated for the BioNTech vaccine. 5 will be for the Sinovac vaccine. When the Sinovac vaccines arrive in Hong Kong tomorrow, being properly stored and arranged, from next Tuesday, which is the 23rd of February, we will accept online bookings for immunization and formally kickstart the program. From February 26th, Friday, in 5 community vaccination centers and 18 GOPC operated by HA, we will administer the Sinovac vaccine for the priority groups. In early March, we will arrange the over 1,000 doctors taking part in the vaccination program to administer the Sinovac vaccine for the public. As for the Comirnaty vaccine, as this vaccine has very strict storage on cold chain storage and must be diluted before vaccination, therefore this vaccine will be provided in 24 community vaccination centers for the public. In other words, the Comirnaty vaccine will be mainly provided in the community vaccination centers, and each center will only provide 1 type of vaccines. Let's watch a short video clip on the operation flow.
政府將喺全港18區設立社區疫苗接種中心。
18 vaccination centers were provided by the government for the immunization. The public must make a booking through the 24-hour booking system to set up a time and place for the first and second dose. The elderly can be accompanied by 2 carers. If the chaperone would like to be vaccinated, they can make the bookings together. The webpage will show a successful booking. And you will also receive an SMS notification to properly store your SMS will be shown when getting vaccinated. The elderly and those requiring special assistance can request for booking assistance at post office or at the public housing estate office. At the day of immunization, please bring your ID card and the proof of being a priority group at the designated type slot at the specified vaccination center, showing the confirmation SMS or a copy of the booking confirmation. And please go to the waiting and info area and read through the relevant flyers, or download a short clip through the QR code, or watch a short video. If you agree to be vaccinated, please tick on the flyer under the consent column. If any questions on the vaccine or the immunization, please make inquiry to our staff. They will also find out any drug allergies or severe allergies effect. While waiting, please bring out your ID card for registration and roll up your sleeves. At the immunization station, the healthcare staff will ask you to put your ID card into a card reader and confirm that you're physically fit to get vaccinated and administer the vaccine with your consent. Upon completion, the healthcare staff will print out a vaccination record, and then you can move to a resting zone. The healthcare staff will check on your condition. If you can leave, you have showed no signs of unwell. And please remember your second dose in order for the vaccine to take effect. Before taking the second dose, we will remind you with the SMS. Beside our PEG record, you can also work through the HA Go and the IL Smart app to check your vaccination record. As you can see from the clip, the community vaccination centers will operate for 7 days a week from 8 in the morning to 8 in the evening. Can you hear me? The public must use the online booking system in the dedicated website to choose the vaccine they prefer and to make a booking on the time and location for the first and second dose. Those over 70 can be accompanied by 2 carriers. If you need assistance to make booking, the post office at the public estate office can help. On the day of vaccination, please bring your identity documents and proof of being a priority group. I must stress that if the public could get vaccinated at the community vaccination centers or at the general outpatient clinic operated by HA, they must make a booking in advance. The booking system allows us to reserve sufficient vaccine based on the actual bookings to reduce wastage.
For those who are staying in residential care homes, those are for the elderly or those are for the disabled, as well as nursing homes, there will be outreach teams arranged for vaccinations to be done at where they are staying. We will send letters to these residential care homes to seek the consent of residents at these places. We will first arrange 10 sizable residential care homes to accumulate experience before we expand the scope to others. Once vaccinated, the recipient will receive the vaccination record on paper form, and they may use IM Smart to download the electronic vaccination record. We will closely monitor the actual situation, say for example, supply and vaccination situations, to timely expand the program to those between the age of 16 and 59 with chronic illness, as well as those under the age of 60. We have more or less completed all preparation work. We're ready to start the territory-wide vaccination program. We hope that you are also ready to get vaccinated. You may visit www.covidvaccine.gov.hk to get the information you need. We will all work together, get vaccinated as soon as possible to fight the epidemic. Thank you. Now we will hear from Professor Chen on safety of the vaccine and various matters. Thank you. Just now, Mr. Nip has given you details about the vaccination program. I'll now move on to the procurement as well as authorization for emergency use. Then I will move on to pharmacovigilance as well as the indemnity fund. You may recall in December last year, the government has legislated Prevention and Control of Disease Use of Vaccines CAP 599K, which empowers the Secretary for Food and Health to authorize the use of vaccines in Hong Kong in emergency situations for specified purposes after taking into account objective medical data supplied by an independent advisory panel, as well as as well as an authorization by a regulator outside Hong Kong for its use. We have so far procured some vaccines. They are Sinovac, inactivated vaccine from Sinovac, and mRNA vaccines from Fosun Pharma Biotech from Germany, as well as a viral vector vaccine of AstraZeneca and University of Oxford. I have authorized the use of BioNTech and Sinovac vaccines for the use in Hong Kong on the 25th of January as well as the 18th of February. We still endeavor to finalize the procurement of vaccines. Supply is tight. We have already ordered 22.5 million doses, but we should not let our guards down, and we should make it our priority to make sure that everything is in place, because there are still challenges in terms of global supply as well as logistics. Well, developers has been working at full speed to develop COVID vaccines for large-scale use. As a result, safety monitoring post-vaccination is important. The government will vigorously monitor the vaccination as well as the safety and efficacy of the vaccines. For example, we will ask those who have just been inoculated to stay at a designated area for observation for 30 minutes, just in case there is any adverse reaction. Should there be any, they will be properly treated by resident healthcare workers. On the other hand, we will also enhance our surveillance mechanism. We have adopted strategies announced by the WHO to timely investigate and assess adverse events following immunization, potentially rare adverse events or adverse events of special interest, where we will set up a reporting mechanism for healthcare workers as well as those in the pharmaceutical sector to report adverse events as well as events of special interest to us. The Department of Health and the Hong Kong U are working together to actively monitor adverse events. On top of that, we've asked vaccine developers to provide us with vaccine safety information according to the law for us to continuously assess its efficacy as well as risks. We have set up an expert committee on clinical events assessment following COVID-19 immunization. Members comprises experts from pediatrics, pharmacology, hematology, immunology, pharmaceutics, forensic pathology, neurology, and microbiology. Once we receive any report or information in relation to adverse events or events of special interest, the expert committee will immediately conduct an assessment. As Mr. Nip mentioned, recipients of the vaccines will be able to make use of the electronic healthcare sharing system to store the vaccination record electronically. With that informed consent, the information can be shared by private and public healthcare sector to enhance our monitoring system. I'll now move on to the indemnity fund. Vaccines being put to use in Hong Kong has already gone through a vigorous process to ensure the safety from clinical tests. However, the research period of COVID vaccine is much compressed compared to conventional vaccines. So we cannot rule out the possibility of a rare or unforeseeable serious adverse reaction after large-scale vaccination. Well, should there be any unexpected serious adverse events after inoculation, the recipients should get compensation. However, civil litigations may be timely and costly. On top of that, there is also a high degree of uncertainty. The Chief Executive has already announced that an indemnity fund will be set up to handle cases of adverse events. The initial funding will be $1 billion. In relation to the claim period, we will at the moment set it to be within 2 years after the last dose of a vaccine. We will take into account the pattern as well as timing of adverse events in order to review the time for claim. I must emphasize that even if a claimant has obtained damages from the indemnity, obtained compensation from the indemnity fund, their right to claim via civil litigation will not be affected in any way. They can still take out civil litigation against vaccine manufacturers. However, the amount awarded by the indemnity fund will be offset from the amount to be awarded by the court. Details, we will make an application to the Finance Committee on the 26th of February. And I'd like to emphasize that all those vaccines that are authorized to be used in Hong Kong are safe, effective, and are covered by quality assurance. The benefits will outweigh the risk. Vaccination is better than no vaccination, and you should do it earlier. And the more people who get vaccinated, the better. Now it is the question time. When you get the microphone, please identify the organization you represent before you ask questions.